Well, hello, everyone. Thank you so much for joining today's presentation, Prop 1 Implementation. I appreciate you all being here for our webinars for cities. We have an exciting presentation ahead. But first, we do want to review a few housekeeping slides. So we'll move on to the next slide to share with you that this session is being recorded and attendees are muted throughout today's presentation. The question and answer is available. We encourage you to use it. Please continue to send in your questions using that question and answer button at the bottom of your toolbar to write those in, and we will either get to those throughout the webinar or at the end. And following today's presentation, you will receive a recording of the presentation as well as the slides. But before we officially dive in, I did want to plug a few upcoming items for you. And we'll first start out with that Public Works Officers Institute. We are looking for calls for proposals. That is, if you have an idea that you want to share with others or learn about at our Public Works Officers Institute in March, we have an open call for proposals, and we ask that you please submit them by this week. August 9th is the cutoff date for that. So please be on the lookout for that. And if you have any suggestions, please submit those on our website. Outside of that, of course, you probably have already heard, but registration is now open for our annual conference and expo. It is taking place October 16th through 18th in Long Beach, California. We encourage you to register. You can go on our website and find out all of that information. And with that, I will officially turn it over to Caroline, who will officially introduce today's webinar.
Great. Thank you so much, Christina, and good afternoon, everybody, and welcome to our webinar on Prop 1 implementation. I'm Caroline Grinder. I am your lobbyist for community services, covering all things behavioral health and homelessness. We are really excited to welcome the governor's office today to provide an update on Prop 1 implementation. You'll all remember that at the end of last year, Cal City's Board of Directors voted to support Proposition 1. Cal Cities has been very involved in California's behavioral health transformation, supporting care court, conservatorship reform, and then also, of course, the investments included in Proposition 1. So we're eager to get into the presentation today. With us, we have two great representatives from the governor's office, including Kim McCoy-Wade, who's the Senior Advisor on Aging, Disability, and Alzheimer's in the Office of Governor Newsom. Prior to that, she was the Director of Aging at the Department of Aging, where she led efforts on the governor's master plan for aging. We also have Molly Wiltshire. She serves as the Director of External Affairs for Governor Gavin Newsom, and her professional experience includes work at various levels of government, including 7 years with the County of San Bernardino. So I don't want to take up any more time. I know we have a jam-packed presentation and lots of updates today, so I'm going to hand it on over to Molly to kick us off.
Well, thank you, Caroline. I appreciate it, and thank you everyone for making the time today. And thank you to Cal Cities for the opportunity and the invitation to come talk with you all about Prop 1. We know, as Carolyn said, you all have been very active in this effort, and so we know you're not a stranger to what Prop 1 is and what it's all about. In fact, a lot of you, many of you, all of you were instrumental in helping us pass these historic measures to transform California's behavioral health system. So thank you for all of your support. It was a heavy lift and our work is not done. So we have a lot of exciting updates to share today. We want to continue the conversation and really looking at spending this time here the next hour with you to share the latest updates, including the bond funding that has been made available already, how your city can get involved, and what you should expect from your county partners as well. So we will try to get to as many questions as we can. So please, as Carolyn and Christina said, put those in the chat. We'll get to as many as we can today. And I'll be sharing my contact information. So any of those questions we don't get to, we're happy to do follow-up. As Carolyn said, I'm the Director of External Affairs, and I lead an amazing team who are working with all of your cities and all of you across the state. So we are also available to set up one-on-one briefings as well if you would like to go a little bit more in depth into your city. So with that, I'd like to introduce my colleague, Kim McCoy-Wade, who is one of the key leaders in our office on Prop 1 implementation, to let you know where we're at and share some exciting updates for you. So Kim, I'll go ahead and turn it over to you.
Thank you, Molly, and thank you so much to the League of California Cities. It was truly a pleasure to speak with your policy committee earlier this summer and then to be invited back to try to continue the conversation. As Molly said, we will try to do both things, provide kind of the overview, the latest, but also enough detail. So if you want to go there, we can start to answer those questions or certainly connect you with the right people to answer those questions. But let's go ahead and dive in. Here's what we're going to do today. We are going to start with what brings us all together, which is our commitment to California and for California to deliver results and to lead. And we're taking a three-step approach, which is how we'll talk about this presentation today. This is what the governor has charged us all to do. One, to act urgently on the most seriously ill, unsheltered, and vulnerable in our families and communities. Two, to build. Many of you are very familiar with the behavioral health, I call it BCHIP, and home key programs. We're going to do even more with the Prop 1 investments for treatment sites and that housing that provides permanency and support. And three, plan or get ready. As you know, Mental Health Services Act was also reformed in Prop 1, and the new day of new integrated county, all things behavioral health plans is just 2 years away, July 1st, 2026. So we've got a 2-year countdown, maybe not dissimilar from the ACA rollout or other big policy changes. So act, build, plan. But let's start with why. I think these are all California things that we share across the state and across our, whatever our job title might be. We want to see mental health care available to all Californians, rural, urban, young, old, no matter the race, no matter the gender, in culturally competent ways. And we know that that includes substance use and abuse treatment, whether it's opioids or any of the number of subs, alcohol. We want to be sure that is considered part of mental health and health for all. Urgency, I don't think I need to say anything about that to this group. Or accountability. We're now coming into 5-6 years of historic investments, and it's the perfect time, the essential time to pull it all together and deliver for the people we serve. Nothing in California gets done without partnership, thank goodness, city, county, public, private, local, state, and more of that. And then again, we're coming off the end, continuing these nation-leading investments in the overlapping crises of mental health, in housing, in workforce, in opioids. It's all coming together, and the people who make it come together are, frankly, the local leaders like you, who are where the magic happens. So with that shared commitment, the governor wants to also make it easier for everyone. So that's why we just launched this summer, mentalhealth.ca.gov. If you remember nothing from this presentation, that will be your starting place for the next 2 years. We hope that's memorable, mentalhealth.ca.gov. 2 things you'll find there. One is just the top line of where to get help, kind of for the 3 stages you might be at a crisis with mental health, 988, of course, looking to talk to someone and how to get through your health insurance to get the counseling that should be there. And 3, hotlines, warm lines, chat lines. If you're just feeling low, depressed, we want to make sure everyone in California knows that we're there for them. And then for this group, you'll also see the Prop 1 implementation, the top lines for the public, the voters who entrusted us with this money and this reform and this change. What are we doing? How are we doing? When can you expect to see it? So that might be your easiest go-to site. As all of the guidance and money and press releases go out, we're hoping to keep the story updated, simple, and clear at mentalhealth.ca.gov. Okay, now let's get complicated. So first, no surprise to anyone on this call, we all feel the urgency when we see people suffering and know we can do better. So next slide just outlines some of the many tools that this governor has created and added and pushed to the counties to use. So behavioral health bridge housing. This is this immediate interim housing. So anyone on the street who is waiting for permanent housing or behavioral health can be housed. It could be a hotel room, tiny home, but just immediate housing. And all counties have received this money as recently as last week. Mobile crisis. This, I'm so pleased to say that this is now statewide as of a month ago. Every county is able to bill Medi-Cal for having a crisis response team that is not just law enforcement, who can go out with mental health skilled folks, social work folks to respond to those calls. Full service partnership, you probably know this, is the whatever it takes model. This has been around for a while. Counties have very different usage rates of it. And some even have a different definition of it. So we're working in collaboration. So we all have a California evidence-based understanding, and we're all expanding it to meet the need. CARE Act, conservatorship reform, and the opioid response, all of which have links embedded with all the many, many, many things being done on those items. Just a quick run through the more detail. Again, we wanted to hit that sweet spot of lots of detail on the slides, but less talking so we can get to conversation and questions. But there you see the money that's gone out to counties. Next slide. The best thing is to see it in action. I don't know if anyone from Fresno County or the South Valley is here, but you should stop by Sierra Summit or Phoenix Landing and see examples of bridge housing that are open this year through that earlier rounds of money. Again, I mentioned mobile crisis. That's how the map looked earlier, but now we're at full coverage. Next slide. 988. Lots of data here, but the point is the call volume continues to increase. The answer rate continues to increase. The staff training and staff quantity and training both continue to increase. So this is amazing that everyone's building this together. Next. CARE Act. I think you probably know if you're one of the up to, let's see, 9 counties now, with Kern coming online very soon. We are so thankful to those first counties who were willing to dive in and say, how do we get people with untreated psychosis, that's the focus population for CARE, how do we get them help in the least restrictive but life-saving way? So petitions, as we expected, are slow and low as we learned together, about 600. We're really excited by the number of people who are getting help without going to court. Their engagement, the county's engagement in full service partnerships and other of those models of care is meaning we don't have to go to court if we can get care, which is the ultimate goal, the primary goal. And then we're starting to hear stories ahead of the data. We had one county tell us about a care participant whose neighbors had been calling 911 multiple times a week about his behavior in the neighborhood, and he now, with CARE Act and the support and services and medication and treatment he's receiving in the community, there has not been a 911 call generated by his behavior in almost 5 months, which for him is very, very significant progress. So lots happening, and what I love about these pictures is everyone's around the table, and I hope when I say that, that means some city folks can see themselves there. County behavioral health, county executive, county sheriffs, NAMI family groups, county health plans, county ERs, everywhere that untreated folks are touching are coming together to say we need to coordinate, we can do better, we have the money, let's build the places, build the systems, and make sure we do it. So it's exciting to be out in the field and see that. And if you're not one of the 9 counties, everyone must do it by December 1st, which is right around the corner. So hopefully, and I believe all counties are actively planning, learning, collaborating, and of course the CARE Act Resource Center is there. The other big piece, the first reforms to our conservatorship for mental health issues was passed last year, and counties have statutorily until January 2026. But as we all know, the governor is urging people to begin now, at least start phasing, at least start with their most at-risk vulnerable people. We've got San Francisco and San Luis Obispo doing some great work training their folks, and Sacramento, San Bernardino, and San Diego looking to go next. I think people know this, but the 2 areas it expanded to was it's not just for serious mental health anymore, it's also for severe substance use disorder. So some serious chronic alcoholism, some serious addiction. And it's also not just if the person isn't providing for food, clothing, or shelter, it's also personal safety or necessary medical care. The heartbreaking examples we hear about people, walking on the highway, not safe. So really, this is meant to be both that kind of last stop in the community before something much more tragic happens, and or a step down from a locked facility. So we are really working with counties collaboratively to build this whole continuum. So I think I will stop with the opioid slide. There's a lot of numbers here on, and I know cities have been on the front line of this, but I think the one that sticks out at me is again in orange, bottom right corner. This is old data, but 203,000 overdose reversals. Obviously, we want to get upstream and prevent those, but we're saving lives together and we're grateful for that. So let me just take a breath on ACT. The point of that is to say, some of what happens in Prop 1 takes some time, but everything I just talked about is available now and is implementing now. And part of what we want everyone to be doing at the county level is having those conversations about how's it going? What are we doing? What are we not doing yet? What could we do better? And we absolutely think cities are a critical part of that conversation. So Caroline, let me pause at ACT and see if clarifying questions or before we go to build.
Yeah, thank you so much, Kim. We have one question from Stephen in the chat. He says that their mobile crisis has very few licensed clinicians, and they're often kind of seen as outsiders compared to programs like In Response and SAFE programs where there's really trained people who have trusted relationships. And he's wondering, how can cities advocate for more licensed therapists to be in the communities and develop those types of relationships?
Well, first of all, absolutely right that I think we all see the evidence that the therapeutic alliance, the therapeutic relationship is one of the best predictors of success. So that's absolutely right. The two things I would say is that we have a shortage, right? And so everybody is working to figure out how we both get more mental health professionals, but also increase everybody acting at their scope and everybody's skill set. So I think this is where counties and cities have to look at what they have and what they can do. And mobile crisis, may not be licensed folks. And this is where I'd say I have to defer to DHCS to get the full details on that program. But I think figuring out that right, what do you have? What do you need? How do you make sure ideally it's not a cold contact, especially with a repeat caller, so that it gets the results we all want. So I would encourage you to get in there, but I also just want to honestly acknowledge the workforce shortage, we're going to get to in a second. That is very real.
Yeah, it is a real challenge. I know we've been working on that as well. We have another question from Lisa. She said, our city has our own mobile crisis team. Is there pathways to get funding to help support and expand it?
Yeah, I would absolutely reach out to the county and see if you would be eligible for Medi-Cal funding through county behavioral health. That's a generic answer, but I know DHCS could be happy to provide more specific TA on your county, but that's the idea, is that let's save our precious 100% local dollars and state dollars for things we can't get covered by private health insurance or public health insurance.
Okay, great. We have one more, and then I think we should keep going so we can get to the rest of the presentation. But there was a question, can these funds be used for homeless outreach? I think when you're talking about mobile crisis and all of that, I think that's the question. Can those Medicare reimbursements be used for homeless outreach as well?
Well, the answer is they're for people with behavioral health challenges. So many of whom are homeless, but not all homeless have behavioral health challenges. So I think that's going to be kind of where you get into what's being done. And so that's what I think the local coordination is genius about. I mean, when I was at a roundtable in a county in Central Valley, we had, well, what about the 911 calls? What about the ER show ups? What about the NAMI hotline calls? What about all the different endpoints where crisis, and which was just wonderful that there were so many doors for people to reach out in that county, but also challenging. So I think it's the blending and braiding of systems and money that y'all have to figure out, but it should absolutely be available to people with behavioral health challenges who are unhoused, short or long term.
Okay, great. Let's keep going, and I'll try to respond to some questions in the chat.
Okay, thanks.
We'll come back. We'll come back around. Thank you.
Okay, so let's talk about building, or $6.4 billion. Again, 6.1 part of Prop 1 was building. It was the $6.4 billion bond that funds two types of things. One is mental health and substance use treatment sites, healthcare treatment sites. This is where you might go for inpatient, where you might go for outpatient, where you might go for residential or group, but where mental health services are delivered in the community. I won't go through the California history of closing our state institutions in favor of community. And as I'm sure this call well knows, that community replacement system did not get built. Well, now we are doing it together. So that's the first part, $4.4 billion for those treatment settings. Again, if you're familiar with BHCIP or BCHIP, as I sometimes say, That has already rolled out to the tune of a couple billion, 5 rounds of funding. So hopefully you have been aware and involved with those previous rounds. Of this 4.4, 1.5 is only for counties, cities, and tribes. So let me just say that again. Counties and cities and tribes are eligible for the whole 4.4, but 1.5 is only for counties, cities, and tribes. And then 30 million of that is set aside for tribes. And okay, this might be the second most important thing I say besides the website. The NOFA is out now for the 3.3 billion. It was posted in July. I believe we'll talk in a second. There's a beginning webinars from DHCS this week. Maybe tomorrow even. So we are ready to launch ready on receiving grants. And I know I've heard from many counties who have begun planning what is left to build in their community, what the people need that does not exist nearby or in the region or at the right, level of care or the right population. So hopefully that planning is underway and you're getting ready to either submit applications or support applications. And then just at the high level, the other side, of course, is 2 billion for what we're calling Home Key Plus. It's permanent housing with that coordinated on-site services that will really help folks with behavioral health challenges thrive. So you'll see later this year, by the end of this year, that money will be made available for ANOFA, 1.1 billion, a little more than half for veterans, and 900 million for all populations. Okay, as I mentioned, the 4.4 for behavioral health is based on BH community infrastructure. And here are the dots. I don't know if you can see your city on there. There is a fabulous, fabulous dashboard, the DHCS, listing every single grant. So this is something that you can do or we can help you with to see what came to your community. Next step. Next slide. So crisis care and planning were the first 2, but then the last 3 rounds looks like 1.5 billion. Launch ready, children and youth, crisis, all have been funded. And the first ones are, so just 2,600 beds. Again, that's the inpatient, that's the capacity that's increased statewide. And then in the outpatient chairs or slots, 281,000 people annually would have a place to go. And there's the list of all the different types of facilities that were funded. And just again, these are starting to come online, which is very exciting. The first one to open was up in the Tahoe Basin region. 600 individuals. It was a treatment place that built another on the land they already had. And it was, maybe no one on this call will be surprised, but it has been fully occupied since opening, filling a huge need in that area. And then even more recently up in Sonoma, Drug Abuse Alternative Center, 50-bed treatment facility, expecting to reach 4,000 folks each year. Okay, the other half, the housing. Once again, let's follow the bouncing ball. 4.4 for treatment sites. Okay. No, I'm sorry, I confused us. Vishesh, let's go back a second. Let me go back. Okay, so I told you about BHCIP, which is what we've done so far. Prop 1 is modeled on that. So here we go. Here is the 4.4 billion that is modeled on that. Again, reminding you 1.5 specifically set aside for counties, cities, and tribes, and 30 million for tribes. And here we go, it's live. And here are the dates. Most importantly, the info webinar tomorrow, the tribal webinar. And thank you to the team for putting the QR code right there. We'll leave it here for a second so you can register if you want. And of course, we can follow up with that as well or put it in the chat and other things. But this is happening. So we hope you are ready to apply for what's remaining to build in your community. Okay. Now we can switch to the other half of the bond. Again, a little reminder of the money, 6.4 billion overall. 2 billion is for the housing with services. And again, most of that, more than half, about half and half, a little more than half will go to vets. So it's modeled on Home Key. We're calling it Home Key Plus. It's coordination between our housing department and our veterans department. And again, you'll be familiar with it, acquiring, rehabbing, motels, hotels, hostels, other sites that can be converted to permanent housing. Again, we're doing what we know works with you all, and we've already funded 250 HomeKey projects that have resulted in 15,000 units, and over 167,000 people have been able to access, and will be able, continuing the life of these projects, to access this housing. So just a few examples, and again, if you're on the call, feel free to say this is my project. But Healdsburg, 22 studio units in what looks like an old motel. Rohnert Park in modular units, a 25% targeted to chronically homeless, which again maybe is a focused population for Prop 1. Here's 1 and 2 bedrooms in a former hotel. And I have to just say, permanent housing for 55 and up in my portfolio for older and disabled folks, and the sensory and mobility accessible units. As we all know, this is a fast growing population overall and unhoused. Here's some manufactured housing in El Centro, focusing on transition age youth. And back to Fresno, former Days Inn Hotel, 96 units. And then we wanted to show also the veterans money. While it will be similar, of course, it will be culturally competent for veterans. And so it's based on the Veterans Housing and Homelessness Prevention. Those of you may remember voting on Prop 41 10 years ago. 600 million was provided. And again, 96 projects were awarded, most are open. 3,249 veteran housing units created, and they were often co-located with non-veterans. So total in these projects closer to 6,400. One of the reasons why veterans, again, I know this group knows, but we have 1.5 million veterans, second only to Texas here. And we have a huge share of the veterans who are experiencing homelessness or are truly unsheltered on the streets. And we also know that veterans have a high rate of mental health issues, PTSD, and of substance use disorder. So the good news is that we are actually in California reducing homelessness among veterans. And so we are really hoping that this continued focus, the combination of housing and services, working with the local expert providers and networks, will help to continue and accelerate that trend for veterans and spread to others through HomeKey Plus. This is the 1.1 billion and how critical CalVet will be. I think I'll just keep rolling. Oh, the picture. This is one of our flagships, Edwin Lee Apartments in San Francisco. A nice combination of permanent supportive and affordable rental for low-income veterans. Okay, so in the building section, we tried to talk about the new money coming out, the 6.4 billion, both the existing and building on the successful models of behavioral health continuum to do more, and building on HomeKey to do more. Let me just stop and see if there are clarifying questions about building.
There are. It looks like one of the first questions I received was, are DV or IPV, as a domestic violence transitional housing, eligible for HomeKey Plus?
So there'll be a fact, I think I'm sneak preview. There'll be a very high level fact sheet released any day now that sort of has the basics on what the plan is. But I think these are the kind of questions we're getting nonstop. What about board and care, to the elder question? What about the DV? So I expect that to be a deep part of the engagement. I know that'll be a deep part of the engagement with HCD to dig down on what other types of housing could provide behavioral health support, right? Because it's behavioral health. So how would a board and care provide both the board and care and the behavioral health is the world I know. Other questions about, with DV, I assume domestic violence.
Yeah, I assume so, yeah.
I mean, I will say it's permanent housing. So let's just remember that it's permanent housing on this side. So, but that's what HCD is leading on. And so that's a great question that should be part of the stakeholder engagement that's happening over there to be ready for the NOFA to come out in draft this fall and final this winter.
Okay, great. And then maybe you want to take a crack at the other question. In our city, one of the largest populations is elderly and disabled. Are we planning programs to get ahead of this? It's tied into Prop 1, but also there's other programs as well.
Yeah,
I'm
so
sure.
that's what part of the boarding care answer was, and I apologize if I was
Yeah.
talking in code. Boarding care, I think as many folks know, the assisted living residential care facilities, often 6 beds in a house in the neighborhood. So we're looking at things like that, but I should say everything in Prop 1 is founded on 2 principles: data and community engagement. So if indeed, which we're finding, of course, all across California and the nation, your data shows you have more and more older adults, more and more racially diverse older adults, more, I think, statewide, the highest rate of suicide is older white men. Do you have the services that meet the need is the question that's being asked. And if not, that's where we need you to act, plan, build. So it's that data-driven community engagement foundation that does look different than it did 10 years ago and 20 years ago, and certainly 50 years ago. So I think that's the challenge for all of us, is to start with a real clear understanding of what our different communities have, all the assets, and what the gaps are that we ought to focus on as we reinvent, transform behavioral health.
Great. And then last question before I think we can move on. Will there be round 2 for the CCMU program?
That I'm not sure about. I actually do need to find that out. I mean, again, this is Crisis Care Mobile Unit. Because it's now statewide, I'm actually not sure, but I can take that back to DHCS and get an answer for that.
Okay, great. We can keep plugging along and we'll come back to questions at the end.
Okay, so now you've acted urgently and dealt with the folks in the most crisis with all the tools at hand. And you have submitted applications to build more treatment settings and more supportive housing. So you are planning for the unified behavioral health system that we all deserve and that we all can provide. So just a real high level timeline again to remind you of this 2 years. So stakeholder engagement has begun. DHCS, their behavioral health transformation resources, their listening sessions, their webinars. If you're not on their email, they do a monthly email on behavioral health transformation. It's really a great place to keep up with this level of detail. So again, they have put their bond funding out. They are now working towards early next year. They'll have the guidance on what our counties expected to do to bring together all their funding sources to say, here's how behavioral health is provided in our county. Here's our needs, here's our services, here's our outcomes. And this all goes live July 1, 2026. That's kind of when, right now we're in the Mental Health Services Act 3-year cycle, where the plan is only about that MHSA millionaire tax money. Coming July 1, 2026, it won't be about the money anymore, it'll be about the people. You'll be blending and braiding together all your money to provide a world-class system in your county. Okay, we're going to spend a little time on this because there's a lot to say, but we still are doing good for questions. So let's talk first about people and money and services. It's very similar to how the Mental Health Services Act, which many of us voted for in 2004 to create the first kind of mental health dedicated funding. Back then, remember, before ACA, before health insurance, many of the people we're talking about really didn't have access to the healthcare system. Many healthcare coverage didn't include mental health care, certainly didn't have mental health parity. So MHSA was a really groundbreaking thing by Mayor Darrell Steinberg, and who said it was time to update it. And let's get real about the focus on the gaps in our mental health system and focus on kids and adults of all ages who are at risk. And just some of the risk factors you all know: homelessness, contact with the justice system, conservatorship, child welfare system. Those are folks who we know are higher risk to need more support. We also know that our mental health system isn't serving everybody equally well. We know there's gaps in rural. We know there's gaps in other languages, in other cultures. So health equity is a very much baked into the go forward. Understanding who is in your community, how they do or do not get mental health care, engaging with cultural stereotypes, stigma, not stereotypes, stigma around mental health, and indeed stereotypes may be appropriate as well, so that all the providers reflect your community and serve your community. This is very much part of the Newsom administration's principles, and it'll be more, it'll be implemented in the guidance and the oversight. All right, what would a webinar be without a PowerPoint chart with percentages? So on the left, every year the BHSA is, it's bringing in about $4 billion these days. Of course, it fluctuates a lot, and that's a problem that's also being addressed. But of that $4 billion, 90% will be going to the counties. That's the big blue circle. And we're going to talk about what the circle to the right, how that money gets split up among 3 priority categories with flexibility. Go back for 1 second. And the other thing we'll talk about is those little slices that are the state-directed sides, I'll say turquoise, teal, and lime green. So we're going to do both of those things, and we're going to show this slide again at the end, but just we wanted to give you a snapshot of these buckets as we go through them. Okay, so the county allocations, I think this has gotten a lot of attention, that as it should, that 30% is dedicated to housing interventions. This is quite broad. This is also currently allowable in the Mental Health Services Act, and some counties do this. This will direct all counties to do this with flexibility for rental subsidies, operating subsidies, and capital. So as this has been about $950 million a year annually, ongoing, for housing interventions for people with behavioral health challenges. The second thing is 35% for full service partnerships. Again, the whatever it takes model. Again, this is already in the MHSA, but we have not had the kind of clarity around this is the model and this is the level, and we expect all of us to move together. This is really acknowledging that some of the people with the most serious illnesses and traumas and deprivations and discrimination take a lot of engagement and a lot of wraparound and a lot of patience, and we're here for it. So giving that money and that support for full service partnerships. Dr. Galley sometimes say, these aren't people at the back of the line, these are people who don't even get in the line. And we want them to be well and thrive in California too. And then the next is services and supports. Again, you'll see this is focused on individual and group services, early intervention. I always need to add that early intervention can happen at any point in your life. We do have 50% of it reserved for at least 51% for 25 and younger, recognizing that those early investments in health in your life course do reap dividends lifelong. But early intervention itself is about the disease course, and early intervention services can be appropriate at any age as someone is experiencing those early signs of a mental health challenge. Now, we have heard and we know that counties are different. And so counties have flexibility to move up to 7% out of any one of those 3 buckets and up to 14% in. So if you said, we really can't spend any more on full service partnerships, we want to move it over to our services and supports, or we really can't spend any more on housing, we want to move it over to full service partnerships, there is that flexibility. You just can't take 14% out of any one place. But we expect and look forward to counties coming in with what matches their needs. Okay, the state, here's a big change that you might be hearing about, is there's 2 behavioral health strategies that are moving to the state for a state strategy. So prevention and workforce had both been money the counties could spend. And the new policy is that both of those would benefit from a statewide strategy. So prevention's coming to CDPH. And again, we look forward to releasing kind of the approach and engaging, and there will be grant opportunities for things like populations, veterans, for example, you could imagine, or rural. There may be counties who apply, there may be nonprofits who apply, but we think a statewide coordinated approach to mental health prevention. The same on workforce. Our workforce department, healthcare access and information, will be working with our community college system, our high school system, our higher ed system to get that pipeline, certifications, licensure, training, really pumping in the way we need it to provide the healthcare for now and the future. And then in order to allow all this, the state took a haircut in its admin money. And again, we'll be doing much more oversight, outcomes, and accountability, but wanted to put the money in the program. So there's that. And here's the pie charts again. Okay, so that's what we're doing. How are we going to know if it works? What's changing here, and this is probably the biggest thing that I hope you have heard about and are starting to at least informally talk about with your county and city counterparts. The plan, beginning in July 1, 2026, must include all county behavioral health funding, all needs, all funding, all services and outcomes, so that you as a resident of a county know what the county's behavioral health system is, as a voter, as a journalist, as a person seeking help. It's much, much clearer how to get help. It is a complicated system. The good news is there's lots of complicated money, but we all want to make sure it's coordinated and delivering results. So the 3-year plan's a big shift. You could start right now by reading your county's current MHSA plan, which is very different. It kind of lists the programs that MHSA, the wonderful programs that MHSA is funding. So moving forward, talking about the needs, the strategy, and how it all comes together, Medicaid, county realignment, MHSA, now BHSA will be really important. Again, reminding folks here, I'm sure but of the county behavioral health money, about a third is from the BHSA, about a third is from Medi-Cal, and about a third is from realignment from 91. So just having a report on BHSA is a funding report, but it's not a system of care report. And that's the goal here, as we can see how all of this blends together. Similarly, there'll be an annual report on outcomes, accountability, and transparency. And DHCS has some new authority to pause and hold money and engage in technical assistance if plans or reports don't appear to be making the progress that we all need. Okay. I will end with the charge and call to action that the governor always gives to us, which is let's really partner with our county leaders to ensure action's happening. So are more seriously ill people in the county being connected with BH services and housing, whether it's through full service partnership, whether it's through care, whether it's through health insurance coverage, but those numbers should be going up because more services are available. Build. What is the county planning to submit? I should note that everybody who applies does need to have county approval and commit to serve Medi-Cal, because again, we're building a system. But we also want to make sure that that's done collaboratively. And so here to help and you partnering with your county to make sure there's coordination there. And then plan. What are the county's priorities for which again, I think probably people already know, whether it's more for the kids and youth who've had such a really tough time coming out of COVID. Maybe it's more Spanish language providers. Maybe it's stopping the folks who are having revolving door crisis, either at the ER or the jail, but kind of lifting up those priorities. And then critically, what's the process? This obviously requires deep community engagement. New seats are being added to your county behavioral health board. The plan will need to go to the county board of SUPS to be approved and to DHCS. And again, the local data and the local community engagement is critical to moving forward together. So those are the questions that we suggest that counties be able to ask and answer. And we urge you to join us in that creative and constructive engagement. And I'm glad we have like 15 minutes to keep talking.
Great. Thank you so much, Kim. Okay, I'll dive into some of the questions. One of the first ones is, after the facility is up and running, where are the additional funds to support ongoing costs? I think I kind of hear from you, BHSA is, hopefully intended to support some of that. Can you talk about that a little more for them?
So I would in fact, one of the many resources that's out from DHCS is housing in the BHSA and how the BHSA can continue to pay for housing. And of course, health insurance, and of course, realignment, and of course, BHSA for the services side too, right? The services bucket as well as the housing bucket, and the full service partnership includes services and housing. So part of what the housing applications are going to ask for is, what is your sustainability plan? And so working with your county leaders to say, this is going to be a full service partnership site, or this is going to be a site where we are able to bill for Medicaid, or this is a site. So absolutely, you're asking the right question. But that is what we are charging, and really hoping to help everybody with some technical assistance on how, even how to housing people speak behavioral health, and how to behavioral health people speak housing. We're all learning a lot together. But that's what it's going to take, is coming together. And that would be the ongoing money that I would look to for behavioral health.
Fantastic. The next question was, our city currently hires an agency to provide homelessness services. Would the county partner to continue that city agency partnership with Prop 1 dollars? I guess the real question there is, like, what if you're using kind of an outside agency to provide homelessness services, and how can we connect them properly to the county to ensure Prop 1 funds are supporting those efforts?
I mean, it's all possible, right? I mean, nonprofits can apply, cities can apply, counties can apply. On the behavioral health services side, because the county behavioral health director is responsible for county behavioral health, I see this next question. I wouldn't say prior approval, but it's a letter of support. And if you're finding that that's sticky, again, our team is here for TA. And, that makes sense in a good faith way, that the county behavioral health says, yeah, this city's going to have this, and this city's going to have that. And they're going to, it all works together. So we do want the county to sign off on it. But if you're seeing, if you're having challenges with that, that's, DHCS definitely wants to hear and problem solve. And I'll just remind folks, it's the same rules as BHSIP, I call it BCHIP. So if you were part of the previous 3 rounds of applying for builds, expect the same rules.
Awesome. And then the last question I have right here is, what website or portal do we use to apply? I know that's all coming online here in the next couple of days. Would they go to the mentalhealth.ca.gov to kind of find that, or?
Well, that's always your starting point. But I will go ahead and put in the chat where that specific page is, because I will acknowledge there's a lot of links and clicks and.
Great. And we definitely recommend, from Cal Cities, absolutely, please join that webinar tomorrow to continue to ask those questions. If you're a city that's interested in accessing some of these funds, please make sure you also join that, so you have all the information that you need. I'm not seeing any questions right now. I guess here's another one. So how does the city apply? Do we need to create a plan and submit it to the county to start the process? I know you covered some of the questions that maybe cities should be asking first, but what would you recommend if you're getting started?
Yeah, I mean, I would reach out to your county supervisor or your county administrator or your county behavioral health director and say, yeah, we have an idea. What's the process for the county? Because I mean, in an ideal world, the county would have a coordinated set of applications going in together, going in strong, and not competing against each other, right? So I think how you start that conversation, it really depend on your local relationships and local. I think county behavioral health directors are starting to think about how they handle incoming in a way that is responsive and not gatekeeping, but also is for assessment. But I know I would not write a whole proposal without talking to my county, but I also wouldn't wait for permission, right? So I think that sweet spot of initiative and, I always say leadership and partnership go hand in hand.
Yeah, absolutely. Okay, I don't have any other questions at this time coming in, but of course, we encourage all of you to stay in contact with Cal Cities and the governor's office, and of course DHCS, if you're able to join that webinar tomorrow, to continue to ask these good questions and to continue to stay in touch as you go through the Prop 1 implementation process. Kim, is there anything else that we should mention in closing before? Well, we've got another question.
I was going to say we've got some frequent questions.
I know, keep them coming. Okay, great. Yeah, I have another one here. Do you have to be awarded round 1 funding in order to be eligible for round 2 funding? Great question.
No. I mean, round 2 will probably, if you're the round 1 NOFA is now. By the end of the year, you'll see the housing notice of funding, and then next spring, next summer, you'll see round 2 of the, we're going to call it it's the last 1.1 billion unmet needs. So there is time, but I would be remiss if I, didn't say, I can imagine a scenario where people who applied for round 1 and were denied will be really well positioned for round 2. But I also would say, take the time you need to do a really good proposal, and the process will play itself out. But good luck. But honestly, I mean, we have built so much in the last 3 years together that really we're hopeful people can really be focused on what is remaining, what didn't get funded in the last 3 rounds from BCHIP, where would our dollar go the farthest, and we can really exceed the goals of what is needed by the data to serve Californians for generations to come.
Great. Any other questions? Now is the time.
Well, I'll do a tough question that we often get.
Great. Great.
And I'm sure you will hear this too, is, this is a lot, and it's a lot of change, and it's a lot of change fast. And so we want to just stay in dialogue. In particular, we're hearing from local groups who do terrific work and who have received grants from the Mental Health Services Act, maybe for 20 years. And now they're very nervous about what's going to happen. And so we have really said, let's talk about that, and let's see how you fit into this integrated plan. It may be that your community determines you continue on as a behavioral health service funded through BHSA. It may be that you now can be funded by Medi-Cal, in which case let's do that and get 50% federal money. I hope all of you know that school districts we've had our second cohort of school districts come online to be able to bill Medi-Cal for mental health services, going live in January. So maybe some school mental health funding that had been there in the past won't come out of MHSA dollars, or will be cut a bit to have the local share that could then pull down the Medi-Cal. So that's good old-fashioned change management. And it's going to require, good communication, good conversation. But I just want to acknowledge that anytime you do big system changes, you all know, as mayor leaders, it's a lot of listening and learning together. So just thank you in advance for what you'll do on the front lines of that, and for relaying to Molly and all of us in the governor's office, when we need to hear more and make corrections, because we'll learn together.
Fantastic. Okay, well, I'm not seeing any other questions coming in. So I just want to close and thank you, Kim and Molly, of course, for being on the line and being available to our cities to answer questions and to get this hard work underway. We look forward to continuing our partnership with the governor's office and working diligently with our cities to ensure they have the information they need to access these critical funds. So, step 1, go have these conversations with your county, ask those tough questions that Kim covered, and make sure that you're joining all the informational sessions and webinars. And again, use CalCities as a resource. We're here to help if you have any other questions. We'll make sure to connect you to the right folks. So with that, I'll close it out. Thank you all so much for being on today. And we'll talk soon. Thank you all.
Thank you, Carolyn.